Alright, for blood pressure, you're going to find a cuff that fits. This one's a little big for her, but it's all we have. You want to find the pulse at the brachial artery. And once you find it, that's where you put the stethoscope. You want to make sure your valve is closed. And you're going to pump it up to 200. And slowly release, listening for ticks and watching the needle bounce. The top number is your systolic number and the bottom number is the diastolic number. Okay, for cardiac auscultations, you're going to listen in 5 different spots. The first one is the right second intercostal space, the left second intercostal space, the third intercostal space, the fourth, and the fifth, which is right at the apex of the heart. And you're just listening for love dub. Okay, for pulmonary auscultations, there's 7 different spots you want to listen to. You're just listening for cracking, wheezing, any abnormal sounds would be something to be concerned with. So you're going to listen on the back. Can you cross your arms for me? This just helps to open up the lungs. You're going to listen in the back and have them take a deep breath. Deep breath. Deep breath. Again. Good. And then you're going to move to the front. You can uncross your arms. It's about right under the clavicle. Deep breath. Deep breath. Again. Good. And you would want to do that bilaterally. Alright, this is a pulse ox, and it checks for the concentration of oxygen in your blood. So ideally you want to do it on a finger. If they have dark nail polish, it's not a good idea. You can do it on the ear or on the toe, but the finger is best. So you just put this little guy on there, and this one also has heart rate, which is nice. Not all of them have it. But the concentration of oxygen should be from 95 to 100. If you just ate, it could be a little over 100. If you haven't eaten in a couple hours, it could be less than 95. But 95 to 100 is the normal range. And this is just a vital you check when you do blood pressure. Alright, an otoscope is used for an ear exam. You want to put a little cover on it, a little shield. You pull on the pinna of the ear. This kind of just opens up the canal. Make sure you don't go too deep. You could bust the eardrum. So pulling on the pinna, you put it in, and you're looking for a pearly, white, gray color. Anything red, black, discolored is abnormal. Wax is normal. It's totally normal. And that's an ear exam. Okay, so this is an ophthalmoscope, and you're using it to look for the retina, and it's a red disc in the back of the eye. So when you're examining an eye, you want to use the same eye. If you're examining their right eye, you want to use your right eye, so it's not any awkward face-to-face occurrences. So you're going to have to get close. You just got to get comfortable with it. You start laterally and bring the light into their eye. Good. And you're looking for, like I said, the red disc in the back of the eye. Okay, so for GI, you're going to want to palpate and listen first. So I always start over here with the liver and the gallbladder and move down to the appendix, over to the stomach, to the spleen. And with females, you can palpate the ovaries. And you're feeling for hardness, rigidity, and looking for rebound tenderness. So listening, you're just listening for normal GI sounds. Grumblings are okay. A lack of sound would be indicative of a problem. So listen in the same areas that you just palpated in. And after that, you would move on to percussion. So following palpations and listening to the GI, you want to percuss. So I start with the liver, and you place 2 fingers down on the liver, and your other 2 fingers are going to be percussing. And you're listening for a thud with the liver. You don't want it to be hollow. Move down to the appendix, over to the stomach. Stomach could be hollow or have something in it, just depends on when they ate. Did you eat breakfast? Over to the spleen. And in a female, you can percuss her ovaries. You sound good. Alright, so changing the regulator on an oxygen tank is really simple. You make sure that you turn the key all the way to the left so that the oxygen doesn't flow out. And this right here is how you're going to remove the regulator. Turn it to the right and it slides right off. Putting it back on, you do the same thing. Line it up with the holes and screw it back in. And we change the regulator when the oxygen tank is out of oxygen. Alright, to check your blood glucose, you're going to use a glucometer. So this is the needle prick that you use, and this is the gun. You stick the needle prick in there, and break off the shield. Put this on, put the strip into the blood glucose reader, glucometer. And then, this is the button that shoots the needle out. Prick yourself, and you get your read.